Coming up.
Anyways, so part 2 of picking your myofunctional therapist, picking how you want to start your myofunctional therapy journey, even might be a better way to talk about kind of today's topics. Because these are definitely FAQs that we get from our patients. We see it on some of these like Facebook groups. There's a lot to be kind of talked out and talked through. And again, we're just going to approach all these questions with no judgment. And
this is a guide because not everybody has the ability to see us. So we just want you to find the good peeps. That's the gist of it. We want the good peeps. On the flip side, if you were like, oh, well, I'm just going to do 2 sessions. Well, sorry, Toots, that's not really going to change your bad habits that you've had for 30 years. Or a kid that's had a bad habit for 8 years. Like, you're not going to be able to cure that in 2 sessions. So,
yeah, actually, I think that's a really, really important point you brought up. Session by session therapy almost gives people like a psychology that like they can just bail out. Okay, well, I'm just going to stop coming to you now that my tongue tie's released because that's all I wanted. There is no replacement for myo.
Yeah, you're gonna sleep like crap if you're mouth breathing. You're gonna sleep like crap if your tongue is not in the roof and you're just constantly readjusting and fidgeting all night to move that tongue out of your airway. You're gonna sleep like crap if you don't give yourself the proper hours. You're gonna sleep like crap if you're like stuffy, clenching, grinding, all the things.
Yeah. So I mean, having like working with a sleep coach on top of myo could be great, but it's not a replacement. We're same with breath work. We love all the different breath work. We, if you guys listen to like our early on episodes with Mr. Dan Hansen, we talk about Buteyko, we talk about Wim Hof, we talk about nasal breathing constantly. That's all we ever talk about. But that would be something I would do on top of or in addition to myo.
We have a special offer for our Munch Bunch listeners. To book a virtual consult with Megan, she's offering a discount of $25 off. Just email her, Megan, at nwmyofunctionaltherapy.com or through her website, www.orofacial-myology.com. To book a virtual consult with Kimmy for the $25 off, email her mouthmusclememory@outlook.com or through the website, www.mouthmusclememory.com. Now on to the episode. Hi, everybody. Welcome to the Munch Bunch podcast. It's Kimmy Nishimoto with my homegirl, Megan Van Noy.
Hello.
And we are myofunctional therapists, and we're going to talk to you guys today about part 2 of how to pick your myofunctional therapist and little tips and just kind of information that for frequently asked questions. So Megan, before we get started, let us pull our Monday Munchie Affirmator card to start this week off with a bang.
Okay. I pulled out a big stack. All right, I'm not looking at it. Kimmy, tell me when to stop.
Boom.
All right. What do we got? No judgment. I think that's really good for today's episode, actually. So no judgment. I release myself from any and all judgments. I find my inner critic, call it into my office, and tell it to take a vacation. As it leaves the room, I let out a sigh, and I begin to enjoy the joy of simply being. Who hired that guy anyway? So cute, the little Joyville. I love it. I'll send you a picture of it too so we can post it with the episode. But I think actually that's a really good intention to set for our episode today, because we are going to kind of get into the nitty-gritty of a little bit of controversial stuff. Like how often should you be seeing your therapist? How long should your program be? Session by session, or do you pay for a full program? Insurance versus out of pocket. Like, we're going to go through all of those things. And if you are a therapist out there who listens to our show and you do it different than us, no judgment.
Mm.
We all like none at all. Everybody does things a little bit differently. We all have different styles. We have different trainings, different backgrounds, different experiences with patients. And so I think that is a beautiful place to start our episode today, to kind of come from that lens. So, yeah, I love it. What do you think, Kimmy?
Hashtag no judgies.
That's right. Yeah. Yeah, we tend to be pretty non-judgmental around here, unless we're talking about, like the Real Housewives. Kimmy loves them.
Oh my gosh, I judge the heck out of them. I love it so much.
That's where we save our judgment. But, I think honestly, of the people in my life, of the people in the circle, the people I know, we're all doing the best we can with what we have. And I think that is an important message as a mom, especially moms who didn't know about this stuff, with their first kid, but learned about it with the second. I think as a provider, you've been a hygienist or a dentist or an orthodontist for, years and years and years, and you're just now learning about this stuff. Kimmy, I think you've shared, and you can actually share this because I don't 100% know, but isn't there an orthodontist up in Idaho who used to pull premolars and now?
Oh, he is actually a friend of mine. Shout out to Brett Christensen. Woo! Lewiston, Idaho. We love him. He's a friend of mine. He has been an orthodontist for a very long time, and he does so much for the community. If kids can't afford expansion, he gives them a crazy good deal because he's not going to send them out the door without helping them. So I love that about him, as well as back in the day, he went to orthodontic school, and they teach, that there's overbites to pull bicuspids, the premolar teeth, and pull things back. So if he has someone that now is struggling with sleep apnea or sleep disordered breathing, he will redo their ortho and he will expand them. So shout out to Brett. He's amazing.
Yeah. But I think that is, a really great example of when he first started his orthodontic career, the standard of care was to pull premolars, right? And now the standard of care is not to do that. And we've seen what's happened to patients. Kimmy has seen firsthand what's happened to her. I have family members who I've seen what's happened to them. And to be able to come back around and say, hey, I know differently now. I know better now, and I'm going to help you with the knowledge that I have now is so powerful. And so, and that's the same thing with moms and giving pacifiers or bottles, or not clipping your, kid's tongue tie because the pediatrician didn't make it seem like it was that big of a deal. I have a patient right now. Her daughter just turned 3, clearly has a tongue tie, has a 4-month-old baby, realized that the baby had a tongue tie, had that addressed, and is feeling a little bit of mom guilt that she didn't know about it for her 3-year-old, right? She didn't know. And at the time, the provider was like, man, this may help, it may not help. And now the provider, who did her son's was like, well, I mean, you could help your daughter, but if it's not impacting her speech, she doesn't really need it. Right. Which we know from our lenses.
It just blew my brains out.
Yeah, Kimmy finger gunned herself. It's not just about speech, right? If you guys have listened to any of our other episodes, it's not just about speech that the tongue tie can impact. And if you haven't, if this is the first episode you've ever listened to, go back and listen to Dr. Baxter's podcast. We talk about how tongue ties can impact us at different ages and different stages of our lives. So, obviously this is a patient of mine. And so I'm giving her the full rundown of everything and to help. But to go back to what I was talking about, we do the best we can with what we know. And so if you ever come see us, if you ever talk to us, if you're ever feeling that guilt or shame that you didn't do these things sooner, guess what? I didn't get my tongue tie released till I was 30. I didn't even know I was tongue tied until I was 27, 28, and I had already been doing myo. I had already been doing myo and didn't realize that like I had a tongue tie because we weren't even talking about compensations until what, 2018, 2019. We weren't talking about that then. So even in this short period of time, we've seen things change and evolve. And so absolutely no judgment up in here. So that's my no judgment rant, tangent, rant, whatever you want to call it. Also, it's December, you guys. So my Christmas sweater game has officially started. So today we are looking like a snack with my little gingerbread. Okay. You will see, if you're a video watcher, you will see all of my Christmas sweaters. And I have definitely thought about just posting a daily Christmas sweater on my story.
I think you need to. Just don't even think about it. Just do.
So I don't know if I have 25 yet, but honestly, I might. So it really could probably do one every day. Like, and again, you guys, no judgment because I love it. So
I might judge you a little bit.
I have some puffy painted sweaters that my mom made in the 90s when that was cool. So, and I still wear them. So yeah, crushing it over here,
Nice.
you know. And I bought Isabel a matching Christmas sweater this year. So we're gonna also be matchy, and it's gonna be very cute. So
awesome.
Anyways, so part 2 of picking your myofunctional therapist, picking how you want to start your myofunctional therapy journey, even might be a better way to talk about kind of today's topics. Because these are definitely FAQs that we get from our patients. We see it on some of these like Facebook groups. There's a lot to be kind of talked out and talked through. And again, we're just going to approach all these questions with no judgment. And, you know, Kimmy and I are both pretty open to knowing that like just because we do it a certain way doesn't mean everybody does, and doesn't mean our way is the only way that's effective. Now, we have a lot of great results with our patients. You know, we both have been blessed with some amazing patients. Yeah, I mean, I just think I can kind of speak for you, Kimmy, because I've got to meet some of your patients, but from my side, like my patients have just been amazing, and they're such great people, and I love working with them. And they get a lot of great results, and they love what we do, and you know, everybody leaves happy. But that doesn't mean that I'm the only myofunctional therapist in the entire world who can make people happy, right? And so you know, as we go through this stuff, I don't want anybody to feel like, oh, well, Megan and Kimmy think that they're the only ones who know how to do anything, because that's just not true.
Yeah. And also we'll be like as objective as possible and just talk about like how we used to and how we do now. Because really this is a guide, because not everybody has the ability to see us. So we just want you to find the good peeps. That's the gist of it. We want the good peeps. Yeah. All right. So let's take it from the top. Question number 1. How often should you see your therapist? So that would be like, how often do you have your meetings with them? Now, for me, when I first started and I took my first course, they taught us to meet once a week. And they were supposed to do their exercises 3 times a day. In reality, this never happened. Because nobody has time to do exercises 3 times a day. You're doing good if you can get 2 times. And then there's some days where it's 1 time. And then there's some days where it's like, okay, well, I breathed through my nose and I kept my tongue where I needed to keep it today. So kudos to me. So some of it is like you have to be a little bit graceful as being a human. But for me now, what I do is once every 2 weeks. And then if there's like a vacation or an illness, then sometimes we have to push. Megan, what about you?
Yeah, so when I started back in the day, I also was seeing people weekly for about 30 minutes. And it was a challenge, you know, it was a challenge to practice perfectly every week. People weren't getting as good of results, or they would They would come back a few months later after they finished therapy because they'd be finished within like 3 months. And they'd come back and they would feel like they weren't 100% in their goals. And so a year in, maybe, I had moved to kind of the 2-week model as well. Every 2 to 3 weeks is kind of ideal in my world. And, again, we do the same thing. We plan around vacations, we plan around sickness, we plan around like life stuff. And I had to do some of my own physical therapy after I had Isabel. I did a lot of pelvic floor stuff. And the physical therapist that I work with actually told me, she said, it doesn't matter what muscle you're working, it takes the body 12 weeks to build new muscle. And I was like, that's really interesting, because that is, all I used to do for patients way back when, right? I've been doing the every 2 to 3 week model for probably almost 4 to 5 years at this point. But my patients who I've seen more on that rhythm haven't come back. They're doing great. We end up working with them for about 6 to 8 months by the time it's all said and done. And they tend to have better long-term results. So that's kind of what has worked for me, worked with my patients, worked kind of in people's schedules too. So now I meet with them about every 2 to 3 weeks. Our sessions are 45 minutes long. Some people like to power through and we're done in 30 minutes, but I always allow for 45 minutes of time. Generally speaking, I ask my patients to practice 5 minutes twice a day in front of the mirror. There's something to be said about not over prescribing exercises, in my opinion. Because again, I want people to enjoy this. I don't want them to get burnt out. I want them to feel like they can actually do it, and not that they need to be at the gym an hour every single day or they failed.
Yeah. That's why I tell everyone, I'm like, listen, I'm not going to make you weight lift. And that makes me really cool. You don't have to go to I won't make you go to the gym. If you want to go to the gym, you can go to the gym, but you don't have to do this for hours. It's 5 minutes twice a day, or double up and do it 10 minutes. Anyway, when I first started, my first program recommended 8 sessions once a week. And the same thing, just not enough time. And then they felt guilty because they didn't do it 3 times a day. And I'm like, low key, I don't even think I would do it 3 times a day.
I already know I wouldn't. I already know that. I know it from when I learned how to do this, and I was supposed to be my own patient, right? So, for me, I think that builds in time, it builds in grace, it builds in the ability to actually accomplish the goals. And I think that it's really important to know what your goals are. I think that's where this can differentiate from speech a lot. And I think that's where we get a lot of frustration from people who've only had the speech lens experience is, well, my kid's been in speech for 5 years and I don't even know what we're doing. So I think being able to have goals at the beginning of the program, share those with the patient, that way we all know we're on the same page. This is what we're working towards for everybody who comes through myofunctional therapy, and then this is what we're working for specifically for you. And we're not done till we reach those goals, but ideally we should reach these goals within whatever time frame we decide. So I do a full program. I don't do a session by session. Some of that is because I want patients to know there's a start and a finish, and they don't have to see me for forever.
Yeah, and also that commitment when you're investing in yourself for something. It's when you okay, this sounds kind of privileged to say this, but I was a dental hygienist and I needed to get massages often because I was in severe pain. And if I didn't, then I would have to cut back on work. So I'm I either go get a massage, or I cut down my days because I needed to, because I had like
Mm-hmm.
a pinched nerve. It's not that I was just trying to like treat yourself, but
Which
when
if you were,
we love that,
no
treat
judgment.
yourself.
No
Yes, no
judgment.
judgment, no judgment. But I signed up for like one of those packages where you can like buy massages and you get them
Oh
once
yeah.
a month. And it was like, okay, this is me investing in my body. And then it kind of like helped me to be like accountable, like, okay, I need to like take this time for myself. So I think that's part of it with the session by session. Like, yes, it
Mm-hmm.
is so nice to have like easier payment options. And there are people out there that do really easy payment options. I
Mm-hmm.
personally, I know that I have like probably one of the most flexible, and I've gotten flack for it from other therapists. Like, you shouldn't be so like, shouldn't have it be so long. But I do, because I just want to give that access. But there's
Mm-hmm.
also other people that do payment options, or like there's discounts if you pay up front versus doing that payment plan. Like, there's lots of options there.
Yeah, and I do, and that does kind of like move us into do you pay session by session or do you pay for a full program? And, again, I think sometimes you can get caught. You can get kind of trapped in this session by session because then all of a sudden on the back end, you've paid for like 20 sessions and you've paid however much, $200, $250 a session. You add that up at the end, you're like, wait a second, I paid like 4 to 6 grand for therapy, whereas like, doing a full program, up front exactly how much money you're going to end up paying.
Mm-hmm. Yeah, and on the flip side, if you were like, oh, well, I'm just gonna do 2 sessions. Well, sorry, Toots, that's not really gonna change your bad habits that you've had for 30 years. Or a kid that's had a bad habit for 8 years. Like,
Hmm.
you're not gonna be able to cure that in 2 sessions. So,
Yeah, actually, I think that's a really, really important point you brought up. Session by session therapy almost gives people like a psychology that like they can just bail out. Okay, well, I'm just going to stop coming to you now that my tongue tie's released because that's all I wanted.
mm-hmm,
And I've seen that, I've been burned by that, right? Like I know people who've been burned by that where it's like,
mm-hmm,
okay, yeah, cool. Yeah, we'll do session by session. I know I'm looking at like 15 to 20 sessions. We'll totally do it. And then they just bail, or even payment plans sometimes like, they're due for their final payment and they're like, no, I don't think I'm going to pay. I'm just going to stop. And, that hasn't happened to me in a long time. But when I was a newer therapist, that happened to me. And it's like, wait a second, like you're you're ripping yourself off by not like completing everything. And you're ripping off the person who is trying to give you treatment and you're shorting them on the commitment that you said you were going to make with them. And I
mm-hmm,
think, I that can be really hard. And then you get that person who's like, oh, well, this didn't work for me. And it's like, well, you didn't finish,
mm-hmm, mm-hmm,
right? Like, well, you didn't actually do the work or you didn't finish.
mm-hmm.
But then on the flip side comes these patients who are like, well, what if this isn't working for me? Like, I'm paying all this money up front and then nothing happens. That would never happen in my practice.
No, there's always something. There's always something. Every single person, in my opinion, has some level of dysfunction.
Oh,
So
yeah.
even if it's not like you're not tongue-tied, well, maybe you swallow weird, and maybe you have like
Mhm.
aerophagia where you're swallowing air and that's causing you to burp or have like reflux or gas or
Mhm.
bloating. Maybe you are not a mouth breather, but you have dysfunctional breathing where you breathe really shallow and rapid with your chest.
Mhm.
Maybe like you don't have sleep apnea, but maybe you have insomnia, and learning some of these skills to calm the nervous system and how to breathe will help with the insomnia. I've seen that time and
Mhm.
time again.
Yeah, and I think, and I probably get caught in this. Everybody worries or a lot of people worry, okay, well, it might work for everybody else. So what if this doesn't work for me?
Mm-hmm.
I don't, in my practice, we don't just go through the motions, right? Like we don't just, well, this week we do this exercise and this week we do this exercise. And
Mm-hmm.
if you're in pain, too bad. We're just going to keep going and we're just going to go through. Like, no, we get to what is going on, what's going on with you. We're not done until we have addressed everything that is an issue for you. We're not done until we get to those 4 myofunctional therapy goals. We're not done until you feel better.
Mm-hmm.
And, and generally, yes, in my world, that doesn't take me more than about 12 to 15 sessions, if I'm just being totally honest, you guys.
Mm-hmm.
Generally speaking, if you're doing the work, 12 is kind of the magic number in my world. And I've seen it time and time again. I've worked with, I don't know, over 500 patients, maybe more. I've stopped counting, you guys.
Mm-hmm.
And of those, I can think of like less than a handful, maybe 5, who like didn't get the results that they wanted, and they were flaky and they didn't do the exercises, and we had to repeat things because they didn't do the work. Usually it's not doing the work, not having that commitment, not valuing the investment that you've made to where you feel like you maybe didn't accomplish your goals.
Mm-hmm.
And again, this is like years and years ago. Nobody these days, we're not done until we help you reach your goals.
I actually just thought of something and I want to like copyright this. I'm like,
Love it.
Sometimes my doctor will be like, oh, should they do myo? I'm like, listen, if you can't brush your teeth twice a day, you shouldn't do myo. You do not have the responsibility.
Right? Yeah.
So add to the
Yeah.
list.
Yeah.
Bonus
Right.
list.
I just think they're like, we're not going to give up on you if you don't give up on us.
Mm-hmm.
Like
Or give up on yourself.
Or give up on yourself. Like I get this, I don't get this question as much anymore, but I definitely do. Well, what if it doesn't work for me? I pay for this whole program and it doesn't work for me. If this isn't for you, I wouldn't be recommending it. You've got a grade 3 tongue tie, you have headaches, you have migraines, you're clenching and grinding. This is for you.
Mm-hmm.
Like you didn't come into my door if this wasn't for you.
Mm-hmm.
So, I think that's the fear around committing to a full program is like, well, what if this doesn't work for me? We would like, at least us, myself and Kimmy, like we wouldn't be recommending it to you if it wasn't.
Mm-hmm. Yeah. Yep. Very true. And sometimes I'll be honest with people, like I've had consults with people. I'm like, I want to work with you so much. I really like you, but your mouth is so tiny and you can't even click your tongue with and it fit in between your teeth. Like your mouth is too small. You really need to see someone for expansion or maybe even jaw surgery to fix that. And that leads us into our next question. Why myo before and after having MMA or AKA jaw surgery or orthognathic surgery? And then we can also talk about like tongue tie as well.
Yeah, I think we could even talk about expansion even. So, yeah, tiny mouths, and it's like, okay, do I do myo first? Do I do expansion first? Why do I need myofunctional therapy before my tongue tie? Why do I need myofunctional therapy before I have jaw surgery? Why, the timing of things can be really confusing. So there is a lot of conversation around tongue space right now. Sometimes I feel like the conversation has gone a little extreme. But it is out there. So there's a handful kind of evaluation factors that we take into account when it comes to should I do expansion before I should do myo. And for kids, a lot of times it can be really helpful to do it before they get into myo because they're still growing. Sometimes some parents prefer to see if they can get their own, tongue up in the roof of the mouth and the kid have some sort of their own expansion. So I kind of laid out there to whoever it is, I'm like, here's the option. We can expand, then myo. We can myo, pause, expand, finish up with myo. We can do myo first in some situations and do expansion later, if myo isn't what ultimately is the best option. Because the tongue space situation, one of the things that we look for is, does your tongue overflow when you suction? So for me, if you're listening, I don't have a whole lot of overflow when I suction my tongue up to the roof of the mouth.
But
Cindy,
I
what about you?
do. But I do.
Cindy does.
So I've trained mine to kind of wiggle worm in, but it
Mhm.
kind of drapes down on the sides.
Yeah, a little bit. Yeah, and you have some coverage. Okay.
Mhm.
A more extreme version would be,
Where the tongue is just kind of
mhm,
overflowing. No matter what they do, they can't nudge it inside because it's just too small. A
mhm.
common rule of thumb is if you can't fit a cotton roll in between your top molars.
Yeah. But I will also say I have seen patients who suction and it overflows, then we go through some myo, and then we can fit it in there. Sometimes it's low
Yep.
muscle tone,
Sometimes
right?
it's low tone. There's a lot
Um,
you can do with just myo as well.
mhm. And sometimes not everybody can afford expansion right away. And so what do we do? I always kind of go with a good, better, best approach. Okay, you have unlimited time, you have unlimited budget, like you're down for like the everything in the kitchen sink, then let's get you an expansion first, right? Um, but if you're not, but you still have symptoms and you're hurting and you're looking for answers and you're tongue-tied and technically you guys, like, I am not a good candidate for a tongue tie release if we go by what these measurements are supposed to be. I have a 5.5 millimeter airway. I have a 34 millimeter intermolar to intermolar. I'm like, which means I'm like 9 millimeters short this way. I'm like 6 millimeters short this way. And I got my tongue tie released anyways.
Mm-hmm.
And like Dr. Zaghi released my tongue tie, and a lot of these tongue space protocols are coming from the Breathe Institute, and that's great. Um, but do I think getting my tongue tie released was life changing for me? Absolutely.
Mm-hmm.
You
Absolutely.
know, absolutely. And
Mm-hmm.
so, when we talk about these things, I think finding a provider who aligns with you, and I don't think putting a blanket on, well, if you don't reach these measurements, then like you can't have myo, you can't get your tongue tie released, you either need expansion or you need surgery. I think that limits a lot of people from getting a lot of help that they could have.
Mm-hmm. Yeah, because that's also like, okay, great, that's awesome, MMA, but jaw surgery, even though it's covered by insurance, it's not all covered.
It's not all covered and it's brutal. I mean, if you guys
Yeah.
haven't heard Sani's story yet, about her MMA and her jaw surgery, it's absolutely brutal. And
Mm-hmm.
so, you know, what if we can get people to a place where they're not in pain anymore? Or like, yeah, maybe not every measurement's perfect, but like if we can help them reach their goals and get out of pain and feel in a really good, stable place, why would we deny them of that?
Mm-hmm. Absolutely. Yeah, I think for adults, like I was saying, if they can't click their tongue and it relatively fit within their
Yeah.
upper molars, I think that's good. Some people don't have the muscle strength at first to
Hmm.
do a full cave or suction hold.
Hmm.
So we can always like pin that for later once they get stronger. But when you see a tongue space issue, like
Yeah.
their palate looks like a V.
Hmm.
It's like a volcano point.
Hmm.
A lot of times there's the cross bites where the upper jaw and the lower jaw are flip-flopped, like
Hmm.
the upper jaw is smaller than the lower jaw.
Hmm.
You'll see underbites. You'll see
Hmm.
like that very severe retrognathic chin that's like the very small tiny chin that's tucked back.
Hmm.
Like you can tell.
Yeah, and you know what? Sometimes if we do myo and we do a tongue tie release and things maybe get worse or we haven't fully reached our goals, then we can do expansion, bite-sized pieces, we can, and my patients know that, like if they know if they're borderline and we're not quite like sure which way we want to go, they know that if things get worse or if they, have any sort of issues, then that's the next direction for them. And so I think that's really, really important and crucial. So, um, any other thoughts on that question, Kimmy? Because I think that kind of brings us to our insurance versus out of pocket.
Oh my gosh, we're like vibing so much. I was about to say that.
We're always vibing. That's why we're together.
That's why we're the bunch.
So that all being said, we also get a lot of questions about, well, does insurance cover this? I only would work with a provider who, covers insurance. And that honestly, generally speaking, no. So if you're looking at working with a myofunctional therapist with a dental hygiene background, like it's illegal for us to bill medical insurance. Like that's it. And like we can't break the law and for anybody, right? So we can provide super bills, and you can submit to insurance on your own for reimbursement. We can accept HSA and FSA type accounts, health savings stuff. But 20, 30 years ago, and even for a lot of insurance now, chiropractic hasn't been covered by insurance. Massage, acupuncture, a lot of these kind of more holistic health stuff is not covered by insurance, right? Western medicine insurance is great when you're sick. It is so helpful when you are sick. If you've been around a long time, you know that my dad had a very traumatic brain injury 5 years ago. They landed him in a coma, emergency brain surgeries. His medical records are over 1,900 pages long. So, and he had 13 surgeries within about 8 months. So, anybody want to guess at his hospital bills, right? We're like, had there been no insurance, we're looking at like a smooth million plus for all of his time.
Oh, at least.
Yeah. Oh, yeah. Over $1 million, right? The ICU room alone in 2017, just the room, nothing else in it, was 30 grand a night. So did my mom have some of the best insurance out there? Yes. So did my parents pay over $1 million out of pocket for my dad's medical care? No. But he was very, very, very sick. Now, what about, does it pay for his chiropractic visits? No. So, insurance, Western insurance, American insurance, whatever, it's great when you're sick, but it's not great when we're trying to prevent you from becoming sick. Which is why a lot of times, medical insurance will cover CPAPs for moderate and severe sleep apnea. But what if you're not a good candidate for a CPAP? What if you don't like your CPAP? Why not look at some other alternative options like myofunctional therapy? Oh, well, they won't cover that. We only cover the CPAP. Well, really? You'd rather wear a Darth Vader mask for the rest of your life than spend a little bit of out-of-pocket investment to not? So yeah, there are speech therapists can bill medical insurance. That's under their umbrella. But not every speech therapist, and they will agree with us. So this is not a hate on speech therapists. Not every speech therapist is trained in myofunctional therapy. They have the same frustrations that we have as dental hygiene is we don't learn this stuff in school. You have to go seek it for yourself. So there are some speech therapists out there who can bill insurance and get some sort of reimbursement, and that's great. So if you are really strapped for that, then I would, but it's going to take a lot of research because it's not every speech therapist in your town who can do it.
Very true. Very
Just
true.
like not every dental hygienist in your town can do myo, right?
Exactly. And then do we want to go there on like what is the average going rate for myo programs?
Yeah. I would say so, just so you guys kind of know, and I think some of it pricing wise is based on your experience. Because I would say the average is anywhere, if you break it down, to anywhere from 1,700 probably upwards to like $5,000-6,000.
Mm-hmm.
It's a huge range. It's a huge
Mm-hmm.
range. Some of it is where you live. Some of it is how many sessions you charge. Some of it is how long you've been around. I've raised my prices over the years. I also live in Portland. The cost of living in Portland is different than the cost of living in Bismarck, North Dakota. Okay. Um, and so I've also worked with hundreds and hundreds of patients, and the price to see me is higher than the price to see one of my 2 associates because I try to give affordable options. So if you come to my practice, you have 3 different options. You can work with myself, you can work with Erin, you can work with Kristen, and I price it on experience because if money is a factor for you, I want to figure out a way to make it affordable for you. And that doesn't mean Erin and Kristen are any less capable than I am. I mentor them in the background. So it's not like you see one of them and then you never get to like get my input again. But in trying to figure out different ways of affordability and cost, that's how I have it laid out. So, there's like $500-ish, give or take, between each of our like tiers. We give you a 10% discount if you pay up front, or we set up payment plans for you. And we won't go longer than our general is 3 months. For certain circumstances, we do up to 6, but I also don't charge more for adding a family member. You could see 2 family members and it's the same price. I don't double it. We won't go past 6 months because then I'm chasing you for money at the end, right? Like, so I have a hard and fast rule on that one. But anytime up until then, we figure out a way to make it work.
Yeah, I think that's all really, really good points. On to our next question. Can I just work with a sleep coach or sleep trainer in place of Myo? So for those who don't know, a sleep coach or sleep trainer is someone who helps you to have better sleep hygiene, which would be like having the right bedtime, when to stop drinking caffeine, kind of like your wind down routine at night. And Megan can speak more to this because she's sleep trained Izzy with Jenny June. Woo, Jenny June.
Yeah, we did. We definitely we went through and actually sleep training is like a hot controversial phrase. But I mean, we definitely like worked on Izzy's sleep to help her like have success in her in her life.
Don't downplay it. Izzy is like the most calm, good toddler I've ever known. Like she is so good, and she sleeps like a dream. She sleeps like a dream.
I know. Okay, you guys, I do have the best toddler in the entire world, and she's gonna give me hell as a teenager probably. But yes, but it was really hard before we worked with Jenny. She like didn't have a great bedtime. She was not a great napper. She would kind of sleep in bed with us because she would fall asleep in her crib and then she'd get upset. And then we just didn't have her on a good routine. The first couple of nights are really hard because there is struggle. And there is, she's voicing her opinions. She's pissed because she doesn't get to sleep in mom and dad's bed anymore, right? And I'm like happy that I'm not getting kicked in the face, right? Like, but not getting headbutt in the middle of the night. But when working with Jenny, and we can do a whole different episode on this, it's not like deprivation or that like you're just like locking your toddler or baby in their room to cry it out and just like, everybody suffers. There's a little bit of like separation anxiety, but you're teaching your kid coping skills. And I think really resetting my mindset around that and reframing what I'm teaching Isabel at this age was huge. But that was one piece of the puzzle, right? Working on her sleep. We had to work on like her feeding and her feeding routine. We're going to have to give our pacifier to a Santa Claus, right? Or do a going away ceremony for our pacifier. Honestly, you guys, I'm the problem. I was the problem when it came to sleep training and getting Izzy to like she's resilient. I am apparently not. I am. It just takes me a minute. I don't like seeing my baby cry, right? But these things, and then we're going to work on the myo piece, right? Like it doesn't replace the function of everything else. And so we can work on our sleep hygiene, and I think that's super important. And actually, Kimmy and I have a handout that we created. It's called How to Get Your Best Sleep. All right. So we broke down best sleep, our little acronym, on sleep hygiene and how to create that. So if you're interested in that PDF to really help with your sleep, we're happy to share it with you. We can link it into our Instagram and everything, as well as kind of a free handout for you guys. But there is no replacement for Myo.
Mm-hmm. Yeah, you're gonna sleep like crap if you're mouth breathing. You're gonna sleep like crap if your tongue is not in the roof and you're just constantly readjusting and fidgeting all night to move that tongue out of your airway. You're gonna sleep like crap if you don't give yourself the proper hours. You're gonna sleep like crap if you're like stuffy, clenching, grinding, all the things.
Yeah. So I mean, having working with a sleep coach on top of Myo could be great, but it's not a replacement. Or same with breath work. We love all the different breath work. We, if you guys listen to our early on episodes with Mr. Dan Hansen, we talk about Buteyko, we talk about Wim Hof, we talk about nasal breathing constantly. That's all we ever talk about. But that would be something I would do on top of or in addition to Myo. Just like we talked about last time, mewing is not a replacement for myofunctional therapy. YouTube is not a replacement for myofunctional therapy. Myobrace exercises that come with the Myobrace is not a replacement for myofunctional therapy. Okay.
How dare you, Megan?
Oh, I feel real spicy about that one.
Controversial opinion. But it's true.
If we're going to start getting spicy about things, that's one of the big things I feel spicy about. Nothing is more frustrating to me than Myobrace providers, especially in the Portland area, not referring for Myo. They're like, oh, we'll just do the Myobrace exercises. Those are supposed to be a tool, not a replacement. Just like any of these expansion options, Myobrace, Healthy Start, Myo Munchie, whatever expanders are out there, whatever functional appliances are out there, they are not a replacement for myofunctional therapy. They help with the structure, but they don't help with behavior, and they don't help with function. And if you're going to get the full benefit, it's structure, function, behavior. You have to have all three. You have to have the trifecta, in order to really see long-term change. So we're all supposed to be working together, and it annoys me that we all don't. But that is a different spicy tangent for a different day.
Yeah, I agree.
I agree. But yeah, I think any of these programs can be on top of and can work congruently and can work really great. I mean, Kimmy will say this, face yoga is not a replacement for Myo, but Kimmy has done a ton of face yoga training and has found some really great stuff to help her myofunctional therapy patients enhance their experience.
Yeah, I like to think of face yoga as like a step up from Myo, or once you have the basics of Myo, then we can start doing that. Or if people are having a hard time with their exercises because they're compensating too much with their facial muscles, then I can kind of help decompensate that, especially if they smile and they're using their nose or their eyes, or they're smiling and their neck is bulging. I can work on that with my face yoga training, Also, the thing about breath work is it can be kind of a a next level too, because if you're a mouth breather who's struggling with just nose breathing, how are you supposed to be good doing breath holds? Like, it feels too hard. You have to baby step. You work your way up.
Yeah. Or how are you supposed to exercise with your mouth closed? Or how are you supposed to, like, if we can't get the basics down, then taking on some of these bigger stuff, you can't just do TMJ physical therapy in replacement of Myo.
Because you're just gonna cause a dysfunction again once it's all relaxed. You're gonna do that weird shoving your jaw forward or pressing your tongue into your teeth or squeezing your back molars, and then just kind of irritate those muscles all over again.
Yeah. So I think a lot of these things are great in conjunction with Myo, but there is no replacement for myofunctional therapy.
Mic drop.
The end. All right, everybody, let's wrap it up. Let's call in the cleanup crew, but no, for real, there really isn't. Technically our job shouldn't exist. You can say that. Technically Myo shouldn't exist because we all should be the perfect nasal breathers with our lips together and our tongues on the spot, and we all chew and swallow correctly, but like, welcome to the real world. And that's why we're here. So but I think these things are great additions. I think there's great modalities. No judgment about doing any of them in conjunction with, but I do think that there's just not, right? There's no replacement for the dentist to get your teeth cleaned, right? Like there's no replacement, like, oh, well, my like barbershop person has some of those weird looking tools. Like I probably could just go to them. Like you'd never do that, right? There's certain people that you go to because they're the specialist. And there's value in that. And there's value in paying for that experience and that specialty, right? Like, yeah, somebody else's myofunctional therapy program might be less expensive than mine. But I have also seen 5 times, 10 times as many patients as they have, right? So what does that say about experience, right? Or, there's something to be said about making an investment in your health. And when you pay a certain amount of money and that's an important amount of money to you, then you're not going to slack off. Who are the worst patients? Teenagers who parents pay for them. Like it's not their money, and not all teenagers. I've had some of the best teenage patients ever, and they know that. And I told them that, and I built them up. But like that investment that you make in your health, that investment that you make in you, it can change your life. And so I think it's worth making that investment. Some of the, I would say some of the most struggle patients are the patients who don't have to invest as much. We've seen that time and time again. Anytime I've given a huge discount or somebody's really financially struggling and I have them pay half price, which I've done, and I do it a lot, they tend to be the patients who struggle the most because there's just not the value there. So, I think that we love you guys and we want the best for all of you. And whether that's working with us directly or working with somebody else that you connect with, I think it's worth taking in consideration the things that we've talked about in both these episodes. But I think it's worth finding your person, whoever that is, and really, and going for it.
Yep. Amen. I don't know if you can amen a podcast, but like I do it anyway.
I think you can. I think you can amen anything you want. Hallelujah.
Hallelujah.
It's all Christmas time. We can do that stuff, right?
Yeah.
So, all right, you guys. So if you guys have any more questions or you feel like there's some like FAQs that we didn't cover in these 2 episodes, comment on it, slide into our DMs. Don't forget we do a monthly Q&A. We're happy to address more questions, whether from a patient perspective or a therapist perspective. We have a good mix of both. So don't be shy to reach out and ask us what's on your mind. You can follow Kimmy at Mouth Muscle Memory. You can follow me at NWMFT. You can follow the Munch Bunch Myo podcast, Spotify, Apple, Anchor, anywhere on Instagram. We're there. And actually, Kimmy's going to post our Spotify Wrapped for the year for episodes. You guys have crushed it this year. All right, like you
Thanks,
have been
guys.
listening. Yes, you have been listening. You've been interacting. You've like got our percentages like way up. We're like feeling ourselves a bit. You guys have been amazing, and we're so lucky. We're so lucky to have you listen to us, and we appreciate it so much, more than you know. So yes, look at our story, and Kimmy's gonna post our Spotify Wrapped.
Yeah, let's just do like a
Oh,
little recap here, though, in case nobody is
yeah, do
cool
it.
enough to follow us on Instagram. But the podcast
They're all
was
cool.
the podcast was heard in 29 countries, which I thought was hella cool. We had your podcast was in the top 10 most shared globally. You're in the top 15 most followed podcast. Your listener's podcast personality is the adventurer who venture out into the unknown, searching for fresher podcasts and gems yet to be found.
We are
And
gems. We're definitely gems.
and we released 17 video episodes this year, and they were in the top 10% most viewed.
Yeah.
So that was really, really, really fun. So thank you guys. Thank you for your support. Please keep sharing it. If you want to share it in your newsletters, that always helps us. We just want to share the word and also help more people in the world. So keep doing what you're doing, and please keep sharing. All right.
Yes, amen.
Have a good Munchy Monday.
Woohoo! All right, bye everybody.